The passive lumbar extension test is a special test used to screen for lumbar instability. A brief overview of today is an introduction of the PLE test, current research findings. We will watch a demo video and finish with class time to practice. The PLE test is used to identify lumbar segment instability. Instability is defined as the significantly decreased ability of the stabilizing systems of the spine to maintain normal intervertebral alignment during movement. Indications to performing the PLE test are reports of low back pain, muscle spasms, and/or suspected weakness of spinal extensors. This test should be performed if a therapist feels their patient may benefit from a strengthening exercise program. Currently, there are no known contraindications to performing this test. A positive finding on the passive lumbar extension test is any report of pain in the lower back, apprehension, or a feeling of heaviness in the lumbar spine. This test is considered negative if the subject does not experience any of the previously described symptoms. The PLE test is performed with the patient in prone while the therapist raises both lower extremities to a height of about 30 centimeters or 1 foot off the table while gently applying a distraction force at the ankles. A positive finding is when the patient reports pain in the low back or a heavy feeling of the lumbar spine. This feeling should go away when the patient's legs are placed back on the table in neutral. A study by Kasai et al. Investigated the specificity, sensitivity, and predictive values of 4 lumbar instability tests. These special test results were then compared to radiographic imaging of the participants. Out of the 4 lumbar instability tests, the passive lumbar extension test showed to be the best method to screen for lumbar instability. The sensitivity for the PLE test was 84.2. This means that 84.2% of participants who had a positive PLE test had a true diagnosis of lumbar spine instability determined by imaging. The specificity for the PLE test was a high value of 90.4. This means that 90.4% of participants that had a negative PLE test did not show lumbar segment instability with imaging. The positive predictive value was 80. A high positive predictive value means there is a high probability that subjects with a positive PLE test do have true lumbar segment instability. The results of this test also found a high negative predictive value, meaning that it is rare for a subject to have lumbar segment instability if they test negative on the passive lumbar extension test. Overall, this study concluded that the passive lumbar extension test is the best test to screen for lumbar segment instability.